The woman will always be the backbone of any family. There is no such thing as a family that we know of in the animal kingdom or the kingdom of man, that the woman is not the backbone.
Our ancestors have always believed that bringing new life into the world is a spiritual celebration. And for that reason, they took pride in the life-giving process. As early as the 18th century, colonizers would come to witness the successful births of indigenous people across sub-Saharan Africa, led by African doctors and midwives. They adopted many of those medicinal practices and brought it to America, where enslaved Africans were relied on heavily as midwives for their slave owners. Black lay midwives played an even bigger role in the sustainment of the Black family, since their deep knowledge of herbal medicine and home remedies were the main source of life-saving care before Black women were given even a fraction of healthcare access compared to their white counterparts. As the American medical field advanced, Black women participated, but mainly as test subjects, at a complete devaluation to their anatomy. Flash forward to today, Black women still experience the highest rate of mortality, regardless of education and socioeconomic status.
I wasn't aware. I didn't know that I was at a greater risk.
This is due to a few key factors, including being ignored because we are assumed to tolerate pain more than others, experiencing chronic stress and trauma due to discrimination as early as the in utero stage, and a lack of attention paid to pre-existing and postpartum conditions.
There's really a level of not listening to women, not listening to the pain that women are feeling. We spend a lot of time encouraging women to speak out, but are we listening?
I'm a Black woman. I come from a Black woman who came from a Black woman who came from a Black woman, and I'm gonna give birth to a Black woman.
As a doula, I support Black birth givers for this very reason, to honor, guide, and nurture us along a natural and beautiful process that is meant for us to rejoice and not be clouded by societal barriers. Now let's get started. The difference between a doula and a midwife is a midwife is focused on managing the safety of your pregnancy and the health of mom and baby. And the doula is responsible for everything non-medical, such as like holistic support. Massage, emotional support, nutritional support, education, advocacy. The doula's role during the birth of a baby is to stay with the mom continuously and help her work through her labor, while the midwife watches from a distance and is a little bit more hands-off. And yes, you need both. A doula is not licensed to deliver or catch a baby, and a midwife is so focused on the medical and safety part of pregnancy and birth that they don't have a lot of time to focus on the emotional and the physical support of mom continuously. When you're looking for a doula, there are just a few things that you want to think about. The first, I think, is that this doula is nurturing and patient. Anyone can actually be a doula. You do not have to be certified to be a doula. This is traditional work that women have always provided to other women. And so this work really comes from, our soul and our heart. Of course, through extra training and through more years of experience, you gain more tools and techniques, and you gain more knowledge and wisdom along the way. So if someone is looking for someone who has been in this work for a while, then it would be helpful to seek out a doula with extra training, with multiple years of experience, but all women can offer this support to other women. Doulas support all choices in childbirth, and we understand that all moms have a variety of decisions that they have to make along the way, and we're there to support them with all of those. And sometimes a C-section is medically necessary. We definitely support that when it's necessary. A doula supports both the mom and the partner in various ways. We help before the birth with childbirth education, understanding their choices in childbirth, where they're gonna birth, who to choose as their provider. We also help the partners to understand and learn how they should support mom. The benefit of choosing to birth outside of a hospital system is to gain more freedom and choices in your birth. You do need to be low risk in order to birth outside of the hospital, which means the likelihood of you or your baby needing any medical interventions is unlikely. When choosing to birth outside of the hospital, you first want to make sure that your health is on point. And by birthing outside of the hospital, you do have more freedom to move your body, to decline interventions. And also outside of the hospital, you have midwives who are supporting you. And so their understanding, their education, training is all rooted in traditional birth and in physiological birth. And so that's where you're gonna be able to experience the type of birth you want. When choosing who's going to be present at your delivery, you definitely want to pick loved ones and providers that support you no matter how you want to birth, whether it's natural or more medical, to be sure to support someone who's going to help advocate for you when you have to make tough decisions. A doula can be an advocate in labor and delivery in various ways. We often protect the space of birth for mom who's having a baby. We often remind her of her choices along the way. We often help lessen the need for medical interventions because we have traditional practices and techniques that we bring into the labor and delivery room that a lot of times are very effective and will lessen the need of extra medical support. We offer lots of natural pain management, and we encourage mom to move and listen to her body, which really helps the process of physiological birth. My favorite coping techniques consist of touch, massage, soft and counter pressure massage, as well as the use of heat and cold therapy. During a contraction, a mom a lot of times will need touch to offset the intensity that she's feeling in childbirth. And so we have different places on the body where we can place our hands in certain ways that really support the mom as she's working through her contraction. We, never know exactly what's going to work for each mom. We just try different methods of touch, and we figure it out as we go. We also like to use heat therapy in the form of a hot shower, as well as heating pads, hot water bottles. And then for cold therapy, we typically use an ice pack around the neck or forehead, or sometimes the lower back. There's a wide range of choices in childbirth, and depending on how the birth is going and depending on where the mother is birthing, she may have to put on a time clock. A lot of times we need to advocate for more time because in the hospital system, they tend to rush birth, and we know that in order for birth to be the most successful and safe, we need to just leave it alone. And so a lot of times we're advocating for time. The other choices in childbirth would be the freedom to move however the mom chooses. And in the hospital system, they tend to encourage mom to stay in bed, to stay connected to machines, medicine. And so those choices that moms have, a lot of times they're unaware that they can say no to these specific interventions and protocols in the hospital. And a lot of times they don't have the energy to advocate for themselves, even if they know their choices, because they're working very hard to birth their babies.